Hi viewers, in today's video we are going to discuss about the planning, the continuation of nursing process. Okay, so already we have discussed about the assessment part and the diagnosis part. Okay, so how you will assess, how you will diagnose, and the parts of the diagnosis statement, the Nanda diagnosis. Okay, so that we have discussed. So now we will continue with this planning. So when we come to this planning part, what we have to remember? So you have to remember that is like three types of planning is to be done when a patient is getting admitted. One is the initial planning, and then the ongoing planning, and then comes the discharge planning. Okay, so initial planning. So what is it? So now when the patient is getting admitted, the patient will have a set of complaints, a set of problems to be dealt with. Okay, so now your planning will be according to the problems that is existing with the patient. So you will do an assessment, you will diagnose, and you will have a set of plans that is to be implemented for the discharge. Okay, so that is your initial planning. And then comes the ongoing planning. Ongoing planning in the sense like now the patient is getting admitted, you have started with the treatment. Okay, and the patient is having a set of procedures, a set of medications, or like set of investigations is going on. So what is your plan regarding this particular procedure or particular treatment or the particular complaint that you have to do? Okay, so you will have an ongoing plan that is done together with the nursing care. And then comes the discharge planning. Discharge planning is when the patient is getting discharged. So that is like your discharge advices, your health education, like where all you have to go in for health promotion aspects, and all those things comes under the discharge planning. Okay, so this is your three parts of your planning. So one is the initial, ongoing, and discharge planning. Then comes the area or the vital part or the steps of planning. So the first planning is prioritizing the problems or the diagnosis. Okay, for example, now a patient is getting admitted in the ward. Okay, now you are the staff inside the hospital and a patient is coming inside the hospital, and the patient is telling a list of problems. So example you take, patient is having the patient may tell, see, I am having severe breathing difficulty, I feel very tired, and I can't walk, my legs are paining, I am having increased sugar level, I am diabetic, I am known diabetic case, like that he is giving complaint. So he has said he is having severe breathing difficulty, he is feeling very tired, leg pain is there, and he is known case of diabetes. Okay, so 4 complaints he has given. Okay, so now which is the priority problem? The first problem is breathing difficulty. First you have to treat this breathing difficulty and then you have to go to the next problem. So always remember your breathing, like giddiness, tiredness, pain, all comes in the priority level. Okay, so first is the breathing difficulty, first you have to treat, then comes the pain, and then comes the tiredness, and then comes the diabetes. Okay, so likewise you have to prioritize the problem whatever the patient is saying, and then the next step you have to formulate the goals. So you have to formulate the goals for the treatment. Okay, so now if the patient is having breathing difficulty, what will be your goal? See, the breathing pattern of the client will be stabilized, or the patient will have a normal breathing pattern, or his saturation level will be improved. These will be your goals. Okay, so you have to set up a goal or the outcome. So once you start with your nursing care, what is your final outcome? What are you expecting for? That is like the patient's breathing rate has to become normal, he must not have any breathing difficulty, he must not have any suffocation, the saturation has to be improved. That will be your goal. Okay, so you have to set up your goals or outcomes. And then comes the selected nursing intervention. So the patient is having breathing difficulty, we said. So now for this breathing difficulty, what all we have to do? We have lot of nursing interventions that can be done. So first is always the assessing part. Okay, so first you have to assess or monitor the vital signs of the patient. So you have to monitor the vital signs of the patient, which includes the respiratory rate of the patient, which includes the type of breathing of the patient. Okay, so how what is the type of breath? That is like diaphragmatic breathing, intercostal muscle retraction is present, tachypnea is present, the saturation level of the patient, all these things will come under your assessment part. So once the assessment is over, then you will be starting with the prioritize, like you are setting the goal, that is like his saturation has to be improved. Okay, then comes the intervention part. So what are all interventions you can write? So first you have assess the patient. So you have to first from the beginning you have to start with your nursing care, finally your medications must come. So otherwise you have to start slowly, like step by step you have to first give Fowler's position for the patient. Okay, so Fowler's position usually causes lung expansion, that is like your diaphragm will come down, causes expansion of the lung. So that can be done. Then teach deep breathing exercises. Okay, you have to teach deep breathing exercises, and we have said the patient is having severe secretion, so you can teach coughing exercises also you can teach. You can give postural drainage. Okay, so postural drainage is like different positions you are giving so that the secretions are like you are trying to get the secretions out. Okay, and what else you can do? You can give nebulization. Okay, so you can now you are there in the hospital setup, you can go with nebulization. In case if there is a requirement for oxygen administration, you have to administer oxygen. So minimum you start with 6 liters of oxygen. Okay, so start administering oxygen. Okay, then you can go in for nebulization. So if there is a need, you can go in for steam inhalation. So all these things you have done. Finally the medical management part, you can go in with medication. So you will go in for your theophylline injections you can give, for bronchodilation you can start. So that is like after the doctor's order. Okay, so these will be the nursing intervention. So next step is the write the nursing intervention. See, we have said a lot of nursing interventions, but whether this is applicable to everybody? No. So according to the patient condition, so now we have said postural drainage. So in case if the patient is not able to sit, this postural drainage cannot be done. You cannot change the position of the patient. So this is not applicable for this type of client. So when you write, you will not write this part. So whatever is applicable for this patient, you will write. Okay, now you are able to understand the planning area. Okay, so I am repeating. Prioritizing the problems and diagnosis. So first is your actual problems, then comes the potential problem, the risk problems, and finally your syndrome, that is like your health education areas must come. Okay, so you have to first plan according to the need, according to the priority you have to start. Then formulating the goals or the outcomes. So you have to formulate, you have to think what must be the ultimate aim of my nursing care plan, that you have to have. Then comes the nursing interventions. What are all the possible nursing interventions? Everything you will write. And then finally writing only the interventions that is possible for this patient, that you have to write. Okay, so this is the step of doing planning for all the patient, for all the problems. Okay, so your thing will go like this. So you will rule out the problem, desired goals, interventions, then evaluation. So evaluation is finally you are going to see whether whatever you have done for the patient, it is working out or not, whether it is effective or not, whether your goal is reached or not, that you have to find out. Okay, so that is your planning part. So now example I have given here in effective airway clearance related to thick mucus secretions. Okay, so now whatever example now I have said is also similar. Okay, so if you want to have one more example, let's see one more example. Okay, so now this ineffective airway clearance related to thick mucus secretion we'll see another example, that is like when the patient is having breathing difficulty, definitely he will have anxiety. Okay, so you formulate one more nursing diagnosis. Okay, so tell me how you will tell. So anxiety related to breathing difficulty. Okay, so how you will formulate? So what what will be your assessment? So anxiety. So anxiety, you have to assess the anxious level of the patient. So you have to assess the anxiety level, whether it is mild, moderate or severe anxiety for the patient. Then you have to set up your goals, that is like you have to decrease the anxiety level of the patient. So what are all the nursing interventions you will be doing? You have to first, you have to assess the anxiety level, then you have to explain the condition to the patient. So explain the condition in the sense you have to tell, see there is some infection in the lungs and because of that you are having breathing difficulty. Okay, nothing to worry. Okay, so explain the condition to the patient. Okay, then tell the patient to ventilate his feelings, that is like tell the patient to verbalize whatever complaints he is having. Okay, listen to the patient, ask him how do you feel now. Okay, now tell the patient to ask him to ventilate, tell him to say how is your problem, what is happening, like how do you feel comfortable, which will make you feel happy, all those things you can teach. Okay, and then you can tell him like the intervention parts you have to plan. So that is your tell the patient to go in for deep breathing exercises, that is relaxation exercises you can tell, so that the patient will have relaxation. Tell him to go in for mild meditation, and he can even go in for music therapy, or tell him to sleep for some time. All these things can relax the patient. Okay, so you will have a list of diagnosis, that is like list of interventions that can be planned. Okay, so you plan and then you will start applying this to the patient. So whichever is applicable for the patient, that you will start applying. So with this, I think you are clear with planning. Okay, so planning, you have your 4 steps: prioritizing the problems or the diagnosis, formulating the goals and outcomes, selecting the nursing intervention, and writing the nursing intervention according to the patient need. So with this we finish planning. So let's discuss about the implementation and evaluation in the next class. Take care. Bye.